Hello guys, welcome to your own clinical YouTube channel. Today we will be discussing an interesting topic regarding MRCP examination and specifically focusing towards MRCP part 1. Okay, so I welcome you all. You are here because either you are preparing for MRCP or you are planning to prepare for the same, right? So we will be discussing in this video regarding the various aspects of MRCP1. I'll be sharing my story, why you are giving the MRCP examination, what is the reason, what you are planning for, what do you expect after clearing MRCP part 1, part 2 and PSS. I will not be discussing regarding this part, okay? At least in this video, we are not going to discuss the aspect why MRCP and what next after MRCP, scopes of after MRCP. We are not going into details, okay? Maybe in some other video, right? Also, we'll be discussing regarding the difference between MRCP examination versus the NEET examination for PG entrance examinations or INIP for the PG examinations in Institute of National Importance. Also, the study for clinical skill and studying for clearing an examination. Are they different entities or the same? Also, I'll be sharing my experience regarding this examination. Okay, so let us start. So, after an MBBS examination or after the MBBS degree, after internship, we have various options either to go into an MD or MS via NEET or DNB examinations, right? Either you can go for an MD or MS in any state or central or INI institutes, right? Or DNB. MRCP is completely different. It is membership of Royal College of Fellowship, a membership of Royal College of Physicians. Okay, so it comes in three parts: part 1, part 2, and PACES. PACES is the practical examination, and part 1, part 2 are theory, pen and paper. As you might be knowing, part 1 consists of two papers with 100 questions each. Part 2 also the same pattern, 100 questions each. And these are qualifying examinations. Unlike that of MDMS examinations, because MDMS examinations are competitive. It is competitive. That means, let us say there are 20,000 seats and 1 lakh candidate appear in the exam, and top 20,000 candidates get their respective seats depending upon their rank. Top 2000 get some good institute or some good seats, and rest of the things continue as per their rank only. It is the story of competitive examination. But in MRCP they are qualitative. That means approximately out of 200 questions, uh, if you clear around 110 to 115 questions out of 200, you can clear it. You can clear part 1, then you can directly go to PACES, then part 2, or after part 1 you can go for part 2, then PACES. In either way you have to complete all the steps to get this MRCP, right? Hope I am clear regarding the exam patterns. So when a candidate is preparing for an exam, let us consider a graduate who is either practicing as a physician or practicing as an intensivist after MD or without MD with some fellowship or some other courses. Then the major challenge is the differentiating the study pattern for enhancement of clinical skills and the study pattern for clearing an examination. Okay, hope you are getting my point. So when we are studying for our clinical skill upgradation, we are approaching a subject in a holistic manner. For example, let us consider we get a patient with history of fever, history of cough, with expectoration, with shortness of breath, who is known smoker, like in this pattern. So how do you approach? I am discussing it in the parameters of studying or improving our clinical skills. So if we diagnose it as a pneumonia, we'll be discussing regarding the severity scores, PSI or curve 65. Then depending upon the severity, either patient is admitted to ward or ICU. Then management, it is antibiotics, the choice of antibiotics for atypical organisms, when to consider atypical organism, when not to consider, depending upon the age group. Okay. Along with that, if the patient gets admitted to the ICU, some other parameters develop regarding organ support, right? Then complications in ICU, if the patient develops ARDS, we have many more to study regarding it. Then the drug dosing, if the patient subsequently develops AKI, drug-drug interaction and drug dosing change accordingly. Okay. Furthermore, severity of ARDS, its stages, and interventions for refractory ARDS and interventions for various organ supports in ICU. So when we are trying to enhance our clinical skills, we are studying in the above parameters from the texts, some textbooks, from video lectures, from our seniors, and articles or clinical studies, right? We are referring all these parameters to get a complete idea regarding a case when we face in our day-to-day clinical practice. Okay, so this is the pattern or this is the style we generally follow for our self upgradation. Okay, but what should be the approach when we are planning to clear an exam? Because every individual examination has its own style. Okay, for example, as we are discussing regarding MRCP part 1, so the question distributions among various topics are already there in the website. You can get it like from cardiology, from nephrology, from neurology, from infectious components. How many questions they're getting? There is a rough distribution. You can get it from their website. Okay, first thing. Second thing, as you go through previous questions, you might notice they focus on some specific entities, some specific areas, and mostly on nice guidelines. Okay, so they do follow nice guidelines and some specific areas like curve 65, a very interesting, very interesting topic for the examiners. Okay, for COPD management, when to add inhalational corticosteroids. Okay, management of hypertension, in what stage which drug to add, management of type 2 diabetic mellitus in general clinical scenario. Okay, similarly, area of lung fibrosis in drug induced or silicosis or asbestosis, which area are affected. So these are some common topics on which they generally ask questions. Yes, they do not repeat, questions are not repeated exactly, but the area remains the same. Okay, so if we master a particular area, you must get the questions, and the questions generally revolves around it. So you must identify those areas and you must master them in order to clear that specific segment of the examination. And simultaneously, as clinical skill upgradation goes on, that is different. Okay, but to clear one examination, we must focus on these specific parameters as per the need of the examination. Got it? Hope you got some insight regarding the difference in preparation styles. Okay, also time also matter. If someone is preparing for the examination with 1 to 2 year in hand, so their preparation style will be different. If someone is preparing with 2 to 3 months of time for this examination, it is different. Person with having prior experience in clinical practice, their preparation style will be different. So it will vary depending upon the examination or the what the examiner basically want. Okay, so basically I am an intensivist, and as far as I remember, I cleared part 1 in my first attempt. Okay, definitely it was not that easy because much of the theoretical aspects were there, and I really had to prepare for around 3 to 4 months. Okay, so the experience I gathered from my examination, I am going to share it with you. Okay, so I must tell you guys, one when starting for preparation for MRCP part 1, first step you must follow is to go through the past paper. It should be the first step. Why it should be the first step? Because as traditional preparation style, as I have seen in many of my friends, juniors or colleagues, they start from chapter A, then B, then C, and from 1 to 10 they just continue reading on the chapters and then practicing MCQs simultaneously, or they just try to master each and every individual topics from chapter 1, then chapter 2, then chapter 3, then chapter 4, likewise they go. But what I personally feel, this won't work in this kind of focused examination preparation strategy. So if you go through the past papers first, then you will have a broad idea regarding the examination pattern. Okay, also you get to know regarding the distributions and the areas to focus on all the topics. Okay, you get to know the segments on which they focus and those repetitive areas on which they set questions and they do come repeatedly. Okay, so also with this past paper you will get to know your weak points. Okay, you will get to know your area of strength. Also you will be knowing your area of weaknesses. Okay, there must be some common topics. For example, okay, if there is a question like that, so you are asked to calculate the specificity or positive predictive value. All the parameters are given, you just need to calculate the specificity or ppv. Let me know in the comment section how many students are out of all the viewers who can solve the question by putting the formula or understanding the concept. I think almost more than 50% of the candidates find it difficult to solve this kind of question. But remember, my dear friends, this is one of the most common topic that is asked in part 1, also in part 2 of MRCP. Specificity, sensitivity calculation, positive predictive value calculation. risk ratio calculation. These are one of the most common topic. Among the 200 questions, you must get at least 1 to 2 questions from this topic. Okay, so you need to identify these weak points on which you need to work, and you are going to get some sure short questions from this topic. Okay, so these area you need to identify before starting your tentative preparation, right? Okay, second thing, here after the past papers you identified the important topics. Okay, almost, if you look closely, 200 to 250 important topics you will identify on which they go on repetitively asking questions. Okay, right. So when you identify these areas during your subsequent preparation of previous questions or topic wise preparation, you will definitely focus on these areas, and your approach should be retrograde. Retrograde means from question to theory or guidelines, nice guidelines, or some other sources. Clarify the clarify the theory aspect of the question, clear the concept, also cover the subsequent areas you feel necessary, then move to the next question, and simultaneously you get clarified yourselves regarding the all the corollary questions that can be formed from this segment, right? So this should be the approach: question, then moving to theory or guidelines, then questions, and subsequently you will learn those areas, right? Okay, then fourth point is approach to a question in the examination. Traditionally we just read a question from the beginning. There is a patient of so and so, he developed so and so on day 5, then so and so, so and so, then what need to be done, or what is the step, or what is the mechanism of action, like that we face a question in this manner. So let us consider an example. Here is a question for you. A 61-year-old man presents to the emergency department with an extensive forefoot infection. He has diabetes mellitus and has a large ulcer that is exuding pus. MRI reveals evidence of osteomyelitis and clindamycin is recommended. Okay, then which of the following best describes the mode of action of clindamycin? So by focusing all these three lines, I mean these three lines, it is one of the shortest question, because in MRCP you will be getting at least 5 to 8 lines, 5 to 8 liner questions. There are huge questions. So when you are sitting in an exam for 3 hours and 3 hours focusing on 100 questions each, it is really a terrible task. Okay, and that too in pen and paper format. Okay, so it is not an easy task to approach each and every question comfortably in your own comfort zone. No, it is not possible for the whole 3 and 3 6 hours. So your approach should be always look for the last line, what he is asking. Okay, so in this question, which of the following best describes the mode of action of clindamycin? So you know the answer. Okay, I know most of the questions will not be that straightforward. Okay, but when you read the last line of the question, and just to confirm your answers, you go through the whole question just to confirm your answer. Okay, and the question already reminds you, question revolves around your head. Okay, you just do not get distracted by the unnecessary informations provided in the lengthy questions. But when you start reading the questions from the beginning, you just, for this example, you focus on, okay, 61-year old, okay, more than 60 year of age, emergency department, what kind of emergency, okay, foot infection, okay, on diabetic, अच्छा, complications of diabetes mellitus, okay, large ulcer, अच्छा, pus, okay, pus culture का, okay, then MRI also done, okay, diagnosed osteomyelitis, अच्छा, clindamycin. So your brain is already working on 1 2 3 4 5 6 parameters, and already it has started thinking about all these complications, all these modalities and all. But the question simply wants one thing from you. Okay, So what I do prefer is to approach the question in a retrograde manner. Read the last line, what the examiner exactly wants, then come to the full question and confirm your answer. That is fine. And I think almost 20 to 30 questions you will get in your examination out of 200, in which only the last line will be sufficient for you to answer the question. Okay, so hope this concept will help you. So currently what I think, out of the 100% of questions, 30% of questions will be from common areas, and almost all the candidates will correct these 30% questions. Okay, it is common for qualifiers and non-qualifiers. Everyone will almost get these questions right. Okay, then rest 30% questions will be definitely difficult, or it will be unusual. Even for experienced clinicians, even for someone who has already prepared for 5 to 6 months with tremendous intensity, okay, it will be definitely gonna be difficult. So rest 30 to 40% questions, they will be from the area of focus, and specifically, as I had already discussed regarding the specific areas, they will just revolve around some specific areas, specific common areas. For example, as you discussed, calculate the positive predictive value. This kind of questions, everyone knows it comes in the examination. Everyone knows, yeah, this kind of questions are common. But I assure more than 70% candidate will not be confident enough in making this question right. Okay, so I think these 30 to 40% questions constitute the gray zone, and it makes the difference. So what I mean to say, if you give the examination today only, okay, if you give examination, almost this 30% question you will make it right. Second, from the difficult question, it depends. Hardly you can say 10 to 20%, 10 to 15% questions, you might get it right. But these 30 to 40% questions, you literally need to focus. You literally need to go through. It actually, these topics will make you feel confident in the examination. Okay, I just do not want to hype unnecessarily regarding the level of difficulty of this examination, but definitely if you have a goal oriented and specific approach, this examination is not that difficult even for a fresher or an experienced physician or an intensivist to qualify. So I hope you people got some idea regarding this examination. So I must thank you, and I hope you will go ahead. Your preparation will catch up some good speed. So see you in the next video, and also let me know if I can help you in your preparation by any means. Do let me in the comment section. I'll be more than happy to share my experiences. Okay, thank you.